Are you sad? Are you depressed about getting pregnant? Let's say you are not ready to get pregnant and you are thinking, what is it that you need to do to solve these problems? Watch this video. What they don't tell you about Postinor 2. Postinor 2 is a form of emergency contraception that is available to women to use in cases of an emergency. This is important to know the facts about Postinor 2 before using it. It can be very difficult to get pregnant after this medication has been taken. Postinor contains a hormone called levonorgestrel, which is similar in structure and function to progesterone, the hormone that regulates ovulation during a woman's menstrual cycle. That's what it is called. Postinor prevents pregnancy by interfering with ovulation or fertilization or both. Postinor 2 doesn't go without side effects and warnings, which is very important for you to know before you go right ahead to use Postinor 2. Postinor 2 is a form of birth control that is inserted into the vagina. It is a hormonal method that prevents pregnancy. This birth control method has some side effects and warning that you should be aware of before using it. Some of the common side effects are irregular or heavy menstrual periods. You can relate to this. You will see some women that go for they go for days and they will have heavy menstrual periods. You will experience breast tenderness. You will have nausea or vomiting. You will have headaches. You will have weight gain or loss. You will have an increased acne on the face, your neck, your chest, and your breast and your back. The most serious warning for this type of birth control, which is called Postinor 2, is that it can cause an ectopic pregnancy. This can be life-threatening, so you should talk to your doctor about your risk before taking this type of birth control. How is Postinor 2 different than other birth control methods? Postinor 2 is a hormonal-based form of contraception that prevents pregnancy by stopping ovulation. It is different than other type of birth control method because it uses hormones to stop the release of an egg, which is called ovulation, from the ovaries and thicken the cervical mucus to prevent sperm from entering the uterus. The pill is taken every day, usually for 21 days, followed by a 7-day break. The birth control, which is called Postinor 2, may be used for other purposes such as treating acne, menstrual cramps, or endometriosis. Postinor 2 doesn't go without having its pros and cons. Postinor 2, as you know, is an emergency contraception. Postinor 2 is a type of emergency contraception that prevents pregnancy after unprotected sex. It can take up to 5 days. It can be taken up to 5 days after unprotected sex and can be used for up to 3 days after taking the last active pill. The pros of Postinor are that it is an effective form of birth control and it doesn't require a prescription. The cons are it can cause nausea, vomiting, headache every menstrual cycles. Okay, how can you use Postinor? How can you use Postinor 2 in case of a breakage or sleeping out? Postinor 2 is a form of emergency contraception that is used in case of an unprotected sexual intercourse. That is what it is used. Or you can use it when the condom has been broken or slipped out. So this is what you have to do if you are in this situation as I speak to you in this video. You have to buy Postinor 2 from any pharmacy and keep it with you for emergency. Then step 2, if there is a chance that your contraceptive pill might have been broken or slipped out, take Postinor 2 within 72 hours of having sex. If it is more than 72 hours since then, you won't be able to take this pill and you will need to go to your doctor for other forms of emergency contraception. Step 3, take one pill as soon as possible, followed by another 12 hours later if necessary. The second dose should be taken if the first one was successful in preventing pregnancy. So there you have it. I want to go right ahead and try this, and I want to believe that you have had enough information, adequate information about Postinor 2 and what you can do in case of an emergency, and this will give you enough information to make informed decisions of whether or not you want to use this to prevent pregnancy and as a form of emergency contraceptive. Alright, thank you so much. This is BAM Health. Thank you so much for watching. If you love this video, give it a thumbs up, like, comment, and share this video with your friends and family. I'm going to talk to you in my next video. Until then, stay safe and be blessed. Bye bye.